I think we probably should convene the seminar, our webinar at this particular point, and allow for people to be joining us a little bit late, because everyone is probably experiencing similar difficulties with logging on. So as of right now, what this seminar was designed to do is to really give us an opportunity to start addressing how we have endured these past few months and the community populations that we need to be able to work with to help make certain that their needs are taken care of as well. So with that in mind, I'd like to first of all welcome everybody who have managed to survive our current hurricane or tropical storm, whatever you might want to call it, that has created flooding issues, power outage issues, and the typical type of challenges we all have in trying to return to normal operations following a disaster. We hope, though, that all of you are safe and staying well at this particular point in time. And we would like to first tell you a little bit about the New York Aging Incubator, the sponsor of this particular webinar. The incubator was established at NYU in 2016-2017 as one of NYU's 3 university-wide initiatives. Our goal in having this initiative is to bring together faculty and students from all disciplines who are involved in the study of aging and its impacts. Our primary goal is to keep the NYU community informed and up to date on research, educational activities, events, and services for the aging population. Additionally, what we strive to do is provide support for the development of innovative and interdisciplinary research, policy, and educational endeavors to improve the health and well-being of older adults. So on behalf of the NYU Aging Incubator team, I'd like to thank all of you for joining our webinar today, particularly our webinar panelists who have more or less squeezed this into their very busy schedule as they are tending to very important issues that the New York metropolitan community is dealing with related to the aging population. My name is Victoria Ravis. I'm one of 3 Aging Incubator co-directors, and I'm pleased to introduce our guest speakers for today's session. We have 4 speakers, as you would have noticed on the flyers. Our first speaker will be Allison Nickerson, who's the Executive Director of Live On. She will be followed by Donna Almordali, who's the Executive Director of the Greater Allen Community Nonprofit Programs Allen Community Senior Citizen Centers, excuse me. And then 2 representatives, Dr. Anderson Torres, who's the President and CEO of RAIN Total Care, and Dr. Jane Arce Bello, who is the Executive Director of RAIN. So all of our panelists will be able to be spending a little bit of time with you to talk about some key pressing issues related to the aging population. And what I would like them to do initially is to just briefly give a brief statement as to what their program or their service is about, and then talk a little bit about what have been some of the service-related challenges and needs that have happened as a consequence of COVID-19, what has been possible to put into place to address specific needs of older community residents, such as services or programs or resources that may have been needed or are available on either a short or a long-term basis. And then ultimately, perhaps as a group, we can talk about, as COVID-19 is going to be with us for a long time, what do we need to adjust to and plan for, and what will be a new normal. So obviously, our panelists will choose what aspects they might want to talk about, but these are the broad areas that I'd like them to consider in their presentation to the rest of you today. At this particular point, I'm going to ask Allison Nickerson to speak first. She has a very interesting role in the aging community, and I think it's a nice way of setting the tone for the rest of the seminar. So Allison, without further ado.
Thanks, Vicki. So I'm Allison Nickerson. I am the executive director of Live on New York, which is a membership-based nonprofit. We have just over 100 organizations that run roughly 1,000 programs in the 5 boroughs and throughout the state of New York. And our goal is to build power and capacity at the city and state level so that older people have access to services in their community so they can thrive. So and we do that really through policy, advocacy, professional development, membership services, and some discrete direct services. I think, I won't talk specifically on the service challenges because I think Jane and Donna and Anderson will be best suited to tell you about that. I think, from my perspective, the biggest challenge has been the massive amount of need that has been uncovered. COVID-19 really exposed both the kind of cumulative disadvantage that people experience through their life, and in New York really are able to patch together services and do okay, but when something like COVID hits, they're really, really in need. And so we have at the same time a massive need, and there's, over 100,000 people in the city's emergency food program who are over 60. So you have hundreds of thousands of people who need services. And at the same time, both because of social distancing and just the underinvestment in community services that we've seen over the last 20 to 30 years, a real restriction about who can get those services and how we reach them. So I think, the need and how we look at it and how we pay for it and how we talk about it is the massive thing that we're trying to grapple with and deal with. And then, the other 2 things I would mention, one is the technology needs, both from the community service perspective. So the infrastructure or the lack of infrastructure that community-based services have to meet the tech needs of older people as folks are trying to log into remote programming, and also for individuals themselves. And then the last thing I would mention that we are seeing a lot of is just the need to approach cognitive issues and social isolation and innovative in different ways. I mean, we've spent a really long time talking about social isolation as the big predictor of mortality. And yet we don't have a ton of evidence or research on what interventions might work and then what during this time would work most successfully. And you can't really expect anybody, let alone someone who is maybe already socially isolated, to stay in their apartment for months and months on end and not have any cognitive impairment. So those are some big issues that we're focusing on, but I really will hand it over to our other 3 panelists to talk about what's happening in their communities.
Okay, thank you, Allison. Donna, would you like to take the stage next?
Sure, can you hear me?
Yes,
great.
I can hear you.
Great. I really want to piggyback on what Allison said in terms of with what we're experiencing with the COVID pandemic really exposed a lot of the areas that we're lacking in. I think as the executive director of several senior centers, we were content with kind of moving along in a status quo of what we thought we were providing in terms of good services, and we were, don't get me wrong, but what it really did show is that it's more than, if we're going to be there for the seniors and our participants and providing the things that they need, we need to be thinking in terms of what possibly could happen. And I'm thinking in terms of just, having to be a cooling center when there's a heat wave, but also if there's hurricanes or tornadoes or any other catastrophe that could come up. How are we prepared, and how are we preparing our seniors to be able to meet those needs? The things that are most concerning to me are those food insecurities and the socialization or isolation issues that we have with the seniors. You know, going into this pandemic and to stop cooking for them, and the seniors are used to the food that we were providing, and moving into a realm of, you know, working with the city to get the seniors food. You know, we have to make sure that we have a better process and make sure that we already have the information on hand to know who are those participants that we have that have these food insecurities, that need to make sure that we have that need to make sure that they're immediately covered. And then with the socialization, you know, the challenge with that was and is, and still very much a concern, is that the only way for us to really reach our population now is virtually. And the senior population is just not that technical. We've got a good group that is comfortable trying. Listen, I think about my parents. My parents are 80 years old. They live in Florida. And we actually have a Zoom call with them every Sunday at 6 o'clock. The family gets on a Zoom call. We play bingo. We play different games. And it's critical for their socialization because they're the only ones. They're alone there in Florida, and it's just the two of them, and they're starting to get on each other's nerves. So, you know, that it's so important. But I spent 2 hours on the phone with them teaching them how to access Zoom and get on Zoom. They're my parents, and they were willing to work with me. We don't have the capacity for being able to stay on a phone for 2 hours with every one of our participants to get them comfortable with working with technology. But we have to find a way to do that. In terms of what we'll do in the new normal, I think even if we when we do get back to the point of being back together in person, it's going to be one of the top priorities that I have is to make sure that we train the seniors on how to use their phones, how to use their tablets, how to get comfortable with their computers, and we'll continue to have these virtual sessions because there are a lot of seniors that they're just not feeling well today and may not want to come into the center. So we should still be able to reach out to those that are not coming into the center. We need to make sure we're not losing touch with those who stop coming to the center and increase the number of the contacting that we're doing so that we are not losing the seniors that are not participating on a daily basis or in-person basis. I think that's how we'll move forward with the new normal. But yeah, those are the points I wanted to cover.
Okay. Is there anything you'd like to add at this particular point related to, you know, you do a variety of services in the community, from individuals who are homebound and require supportive care to those running senior centers. Do you want to talk a little bit about where you feel the current needs are right now, or some of the challenges you were having in the past few months in trying to make certain that elder adults are still receiving the necessary services that they might potentially need, or concerns you have relating to that?
Yes, I'll touch on that. And yes, for the Allen Community Nonprofit Program, we certainly are covering several areas. The church has a food pantry, and of course we have several senior centers. We also have a battered women's shelter. So we're seeing across the board where the needs are. I'll start with the fact that even though for the seniors, the city is providing meals for them, and they vary depending on where the senior lives, the food pantry lines are triple what they were before the pandemic. The amount of need that has come from this pandemic, and even the demographics in terms of age of people that are participating in the pantry it has significantly increased. So, the challenges that I'm seeing certainly are around food, and I think that all just kind of comes into what's happening with the pandemic and the economy, and people have lost jobs and so forth, or been furloughed. So there's certainly a lot of need that's going around. One of the other things is the isolation is one of my biggest concerns after food, because while we're able to get food to people via the pantry, via the city providing food to seniors, the isolation can be just as damaging, and it's a very big concern. In the past, they had the opportunity to come to the senior center when they were able, the seniors, and people were able to socialize. In this new normal, or this new environment that we're in, it's a very big concern, and I'm not sure how we're going to be able to combat it in a significant way going forward. Certainly, again, we can reach out technology-wise, but it's a very big concern from where we were before the pandemic to now, because now there's a lot more fear for the senior population to come out for anything. But there's also that concern of them being home and being home alone, or like my parents, being home as a couple and getting on each other's nerves. So there's a lot of concern in terms of how we move forward to help combat some of the changes that have occurred since the pandemic started.
Okay, thank you, Dolly. I'm Donna, rather. At this point, Anderson, would you like to add your insights as to what is going on with your range of services that RAIN provides seniors?
Sure thing. Good morning to all. Buenos dias. It's an honor for me to join you this morning in this important webinar discussion, especially for RAIN, who's been a provider of services primarily to the older population since 1964. We're an integrated system with over 20 programs that includes home health and programming meals. And Dr. Bell is going to elaborate on the operational challenges that we've encountered. It's interesting. Accuse me of being a mama's boy. I call my mother every day. Unfortunately, she's in Puerto Rico, and if I am lucky enough to get her on video, I get her ear. Because she's also technologically challenged. So we have to address that. But that's the reality of many people that we come across. And she's just an example of many others. We've all seen the evolution of our community members through time. And I'm sure that, as we engage in discussions with our older population and how they've come along from the 60s to now, and the perception of aging and all that, it's changed a great deal for them. But unfortunately, it hasn't changed much for society. I think that there's still, a lot of images and expectations of the older population that really contributes to ageism and oppression. Look at the elders and the space that they're in, and it's a more transformed group. No one expected this COVID-19 pandemic, and agencies like ours had to quickly change the way we do business in hopes of surviving, but then at what cost? Society is quick to focus on other populations, and the older discussion tends to take a back seat as if they don't matter much. It's already, their time has passed. And so I personally got involved with folks being hospitalized. And in one example, I received a call from a caregiver on a Wednesday night in hopes that we would be able to assist Mr. Ruiz and his 88-year-old mother-in-law, who was in a hospital ER for 3 days, was COVID positive. And he broke down sobbing, and he voiced how she wasn't being fed properly, was forgotten. No meds were given to address her underlying conditions. And he felt that this was more so because of her age, and the hospital staff didn't care. So we contacted the hospital administrator, action was taken, But unfortunately, after 5 days, Mrs. Gonzalez died. In another setting, also with RAIN, a family overheard clinical staff state, let's focus on the younger patient because he doesn't have underlying conditions like the 75-year-old with diabetes and cardiac disease. We can't take a moment. We have to take a moment to reflect on the ethics around these decisions and discussions that are still taking place. And as late as yesterday afternoon, I heard this concern from an older whose relatives are in the state of Florida, and the political decisions and the ethical debates as to who has a right to live, and the older population being seen as a burden to society. I have concerns regarding the behavioral impact on my elders in the organization and beyond our service lines. There has been a higher report of depression, anxiety, fear, and trauma being reported. We see it, we're experiencing it. And on a professional level, we also don't hear much about the work of social workers and their impact and involvement in this process. As an organization, we did our best. We had social work interns whose internships had to abruptly change and they went into a virtual mode. But it was a jolting experience for them as a profession. And as a not-for-profit organization that's also very social work, grassroots committed, not to see our profession really highlighted as part of the discussion as we advocate for the seniors or the elders in our organization and beyond. There are also a lot of concerns regarding the service connections that remain a strain. Who do we call to advocate for the multitude of complex systems, from testing to antibody testing to go into the facility for treatment when there's fear? And let me tell you something. The reality is that now some of our elders who are going for the testing are told that they're going to be getting their results between 3 and 8 days. So what happens if they're positive during this time span? During the time that they may be infecting others or still, be more vulnerable than another individual because, again, the complex medical needs. So they're going and they're not getting the information fast enough. And then that goes out into the community and people then will have a concern about going to a facility because they're saying, what's the sense? And then they're, encouraged to register electronically to get results on that platform. So it goes back to some of the individuals that may be challenged on the technology level. Where's our marketing and branding, and how do we make it relevant to our older population? And I think that we could all do a much better job to challenge outdated perceptions about the older population, and that contributes to oppressing a group. And we remain, concerned about future pandemics. We're hearing from the older population, this is only going to get worse. Wait until the fall comes, or wait until fall winter comes with flu, right around the corner. How do we manage that? And, those are like my viewpoints from, high level, but really passionate about the equity for this vulnerable population. And Dr. Bello, if you want to elaborate.
Sure. Building upon what the others have already spoken about, one of our primary concerns is clearly this abrupt change that the older adults experience from one minute to another, where they experience an unforeseen disengagement from the social supports that they had. Senior centers are a primary resource for older adults in terms of social support and social connections, and the abrupt disengagement was definitely the first red flag and the first area of concern for all of us, for the entire field, and clearly for RAIN as well. We heard how we know that senior centers give older adults a sense of membership and contribute to their sense of self-identity. And so we heard time and time again about how this abrupt change in their engagement really impacted their quality of life and how they even perceived that quality of life. We all were mitigating and navigating these unprecedented, uncharted waters. And so we, like the entire field, began to engage in these daily wellness calls and telephone reassurance calls. And, from the very beginning, we made upwards of 37,000 calls in a month. And we made those calls while we were making those calls, we were also experiencing organizational strains and challenges. In the same way that the older adults experience an abrupt change in their engagement, we, obviously the field was experiencing an abrupt change in how we went about doing business. We were also experiencing our own staffing shortfalls related to COVID and school closings and other issues. And as an organization, we were also mourning the loss of staff members. So all of this was going on at the same time. And so again, all of this uncharted waters, none of us have ever really experienced this. But one thing that consistently we heard was the gratitude of the older adults for our engagement in these calls that we made on a daily basis, and their appreciation for knowing that someone cared so deeply about them that they took the time to call every single day to check on them. And we also navigated the waters of virtual programming, and we had some challenges. We conducted a survey early on of older adult capability, equipment, technology, Wi-Fi. And we learned really quickly that there were many, many older adults that didn't have the equipment that was necessary. And they had an interest and a willingness and a desire to engage in virtual programming, but they didn't have the equipment. And so internally, we got together and we undertook a campaign and were able to leverage 300 tablets and established a tablet loan program so that we would bring these tablets to older adults who didn't have the technology. And we're still working on identifying other resources because clearly 300 tablets, we have 13 senior centers. We serve hundreds of seniors, all of them combined serve thousands of seniors. And so 300 tablets was just touching the tip of the iceberg. But again, it was an initial effort that we were able to make and leverage. And that was important in now being able to move forward with the virtual programming. And we've had some really good successes in some of our programs. We've done things from traditional exercise classes and yoga, Zumba, and we've done birthday parties. And we have planning cooking classes in the future. We're going to be doing a sip and paint. And so we have a lot of success. And at some level, we also have a lot of work. That's
Dr. Bello, I think we need to clarify. The sip is not alcoholic.
No, we're sipping coffee.
Okay.
No, we're sipping coffee. But we still have a lot of work to do in really being able to facilitate virtual programming at another level. But, Dr. Torres mentioned ageism, and that definitely is a topic of great interest to me. And I've done a lot of literature searches and research in this area. And one thing that I think it's important for us, though, is to highlight the successes, because we need to more effectively dispel these myths about ageism. And so while, yes, there are a lot of older adults that don't know how to navigate technology, we have Faye, who's 71 years of age, and we have Liz, who's 78 years of age, and they have been able to navigate Zoom without a glitch, They've participated in every single virtual program that has been offered by one of our senior centers. And I want to say it's upwards more than 8 activities that are ongoing. And they are so grateful for this opportunity to be able to engage in this. And they speak about the value that it brings to them and what the joy and how much it's enriched their lives. And so we need to do more, I think, in the area of bringing the technology to the older adults. And also we need to continue as a field to enhance our own internal IT infrastructure so that we're able to, meet the continued needs of the field. And I think as we look, toward the future, we still continue to face this paradox. The concern regarding older adult well-being, and also the concern about older adult emotional well-being. And so, there are older adults that want to come back to the centers. Just the other day, we got a call from someone who said, please, I'm losing my mind, literally. And I quote, please, I'm losing my mind. I want to go back to the center. When are you opening? And then obviously we can't open until it's safe for them to open. But at the same time, that call from her conveyed this message of this emotional kind of plea to us that, and so, it's a paradox that we're going to continue to face. And whatever that new normal may be, I think I agree with Donna, it's not going to be what it was before. And it's going to encompass both virtual programming as well as hopefully some congregate in face-to-face programming. But, before I end it, I don't know if I'll have the opportunity to say this. I really want to thank and acknowledge the staff, our staff and the staff of all of our aging services programs that have been out there doing this work, and in particular those that serve our home delivered meals programs across the aging sector. They really have been the frontline workers, and we don't hear about them as such, but they are. They've been out there, and we're so grateful to them. And so we need to convey these positive messages about the work that we're doing to make a difference in the lives of the older adults.
Thank you, Jane. You really ended on a note that is a good transition, because one of the points in organizing this particular panel discussion was we chose panelists who were really dealing with providing services and care in the areas of the city that were most impacted by COVID-19. And as such, your experiences and what you are both doing as well as the challenges that you are coping with are ones that I think bear shedding more light on. And I'd like the other panelists to add to Jane's comments related to the challenges of what is going on with trying to maintain as much services as possible, and then a little bit more on the perspectives of the staff who is engaged in still working with serving the community. So at this particular point, whoever wants to jump in first with a comment.
Well, as Donna's getting ready to speak, I want to say that the feedback that we hear from the staff is that they feel that they're making an impact, that now more than ever, them assisting a vulnerable population really fills their heart. It gives their life a sense of purpose. And that's not something that, you could ever compensate enough. But I also hear on the home care side, the fear and the concern of entering a home where you may have a family that consists of, an intergenerational type setting, and who is actually taking enough precaution, or who's putting anyone else at risk, and having apprehension in going to this home, regardless of the fact that they are equipped with PPE equipment. So that is a discussion that's pretty delicate at this time. I can only imagine that it might intensify as we move into the fall weather, and depending on the news of the day or what's on TV, you know, and what's being magnified by media, people react to that, and that may make the worker's life a little bit more challenging.
Donna, do you have anything to add?
You have to unmute, Donna.
Can you hear me?
Yes, we can hear you.
Okay. I wanted to also just kind of say that, you know, again, like Dr. Bell, the staff has been amazing at really kind of stepping up and kind of moving into this new normal of how we work, doing these wellness calls and doing Zoom calls and playing bingo with the seniors over the phone and things of that nature. The thing that they're hearing constantly also is that, you know, as both my colleagues is, the seniors are ready to be back. They're like, well, can we just do a half day, or can we just do a couple of hours? And you know, we would love to be able to do that. And the staff, they're very anxious, and they're waiting to hear what's going to happen and when we're going to be called back in, because they are concerned for their own health or the possibilities. We have been called to be a cooling center, so there's additional concern there in terms of making sure that we, you know, open in an appropriate way. You know how their concern is, you know, with the seniors. The challenge is going to be keeping them socially distanced, because as soon as they have an opportunity for us to be open, even as a cooling center, they're going to want to socialize, and it's going to be a challenge to keep them separated. But it's just a new way of thinking, and really trying to make sure that both the staff and that the seniors also kind of have an understanding that we have to move differently going forward.
No, you could also see the level of frustration and sadness with the workers and with the seniors. You can see the affect. Look, how do we now greet each other these days? And it's almost like you have to go through a mental checklist, and you see people's movements from this to then hesitating to doing this, and then either finding a way to either elbow, forearm, or foot. And it adds another layer of stress and anxiety. And listen, you know, there's a lot happening all around the world. I'm sure you all saw what happened in Lebanon and so forth. And these are stories that if the older population were congregating in how they used to congregate, these would be topics of discussion, a way to vent, right? A way to validate their anxieties, their fears, the impact that life has on them, news. Some of our elders have relatives living in other parts of the world. And so right now, not having the ability to interact and share in real time creates that level of anxiety. And for some, like I said, might go into a depression or trauma, depending on their background. Outlets are outlets, and the senior centers have been a tremendous resource and an outlet for all. And you know, we admire the work of Live On New York and advocating for the rights of the older population and making sure that there are enough funds, or that the attention on the political elected level is there for this population.
I want to respond to that also, because one of the things that you know, we're always obviously we're doing the Zoom calls and conference calls. Our most popular call that we have is we do what we call a check-in, where everyone can just get on the phone and have that socialization time. It's kind of story time. It's just interactive time, and it's amazing. It's just like you're saying, Anderson. They just need the opportunity to socialize. You know, one of the challenges with that is there are a number of our seniors who have what they call the Obama phones, and they're limited in the minutes that they can use. So they have to pick and choose what activities they'll participate in with us. So there's, but that socialization is so important and so key to what we need to do right now to make sure that our seniors are taken care of.
I don't know if you
Okay.
watched the Jane Pauley show on Sunday, but they had a coverage on social isolation, but they were saying how important it is for us to have the ability of recalling those hugs, and to also do self hugs, because something is better than nothing.
Okay. Allison, is there anything you'd like to add related, to the fact that as a advocate for a range of organizations that are providing the whole continuum of care for aging services, there may be other perspectives that you as the executive director of Live On might be able to add in. So I'd like to give you an opportunity to say a few words.
Vicki, do you specifically mean on the staffing side or overall?
Both.
Sure. I mean, I think, we are not necessarily related to COVID, but this certainly highlights the need. In 2021, the city is going to go through an unprecedented political shift. We have, I think, 37 of the 51 council members will turn over. The mayor will change, the comptroller will change, the borough presidents will change. I think the BPs will change, and the speaker will change. And so, now is the time that we need to, and certainly at Live On, wearing my Live On, hat, we are thinking a lot about how to make sure that these issues stay in the political will of the people in power, because it's really, the ageism is real. I mean, I was a social work intern. I am a social worker. I love our social work interns, but every year there's one young person who doesn't know how to use the printer, right? And I would never say, oh, those 23-year-olds, they don't know how to use technology. No, I would assume that they weren't taught, and I would work with them to figure it out. And the same is true with older people, right? Just because they are older doesn't mean that they can't figure it out. It means they were never given the space, the bandwidth, and the tools to figure those things out. So I think at every level, we need to make sure that older adults, and all of us, right? Every one of us wakes up one day older, whether we like it or not, and whether we fight it or not, we all, by the grace of God, wake up one day older. Need to think about our old age as a time to thrive, no matter your ability and income, and a time to be visible. So, in our advocacy, we think a lot about, we're thinking a lot about how to elevate CBOs and the nonprofit leaders themselves, because it can't all come from one organization or one entity. We are thinking about older people's voices, because they are the folks who really have lived their life and have a future and want to speak for themselves. And then making sure that everyone, on the call today and across disciplines has an opportunity to make sure that these issues don't disappear. It is amazing the lack of, I guess I'm naive, I think, the lack of coordination and the lack of thoughtfulness that happens at the highest levels of government when people just make decisions and don't really know how that's going to impact communities. So it behooves the communities themselves and organizations like Live On, like everybody here, to elevate those issues and make sure that people pay attention. I think there's so many great things happening. We put out a list of many of our members' virtual programs. I mean, the depth and the breadth of the services are real. I mean, they're really good services. It's infuriating to me that no one can find those services often. So if you're hooked in with the senior center, that's great. And usually people know what's happening. If you're not, or if you're a caregiver who says, who lives in Florida and, mom lives in Queens, it's hard to find where those virtual programs are. And the Department for the Aging at the city level has been, a subject of ageism institutionally. So that agency has not been invested in, and we don't have, the Parks Department pre-COVID, you could look up where a yoga class is happening in this park and it would tell you when. That doesn't exist in aging. So there's a big opportunity to draw people in and have open source programming so that more people can access this work. And again, it elevates and lifts the work of all. So I think, you know, those are the challenges. There, I could go on and on. I think, you know, we're all very eager to find out what happens with the federal legislation. The city and the state are banking in a very big way on getting state and locality funding from the federal government. New York City and state are in a really bad fiscal situation if they do not receive that. We also are really pushing for SNAP benefits to be restructured and increased so that older adults and of course all households can have access to SNAP. So I think there's a lot of work to do, but there's a lot of energy to do it. And so I think with all of our coordination, we can certainly move the needle.
Thank you, Allison. Some of the attendees may not have a fully clear idea of the range of services or the function that Live On provides for the whole continuum of care for aging services. So if you could just briefly, in a few sentences, kind of explain what Live On is when you talk about member organizations and what you are doing.
Sure. So Live On was founded in 1979 when senior centers started to exist through federal funding and state funding. So we today are a nonprofit that represents community-based senior services. So that includes senior centers, Meals on Wheels programs, case management services, affordable senior housing, developers and managers. We have some assisted living facilities, but most of our members are the community-based infrastructure that receives federal, city, and state funding to provide support in communities. And we do that, our strategies are to advocate and promote policies, specifically budgets that are reality-based and meet the need of older people in New York City and New York State. We do a lot of professional development and training. And then we also have a benefits outreach team that works with several thousand older adults every year to help them make ends meet through benefits and entitlements.
Thank you. What I would like to also kind of emphasize so that it's not lost in our dialogue is that when we are talking about older adults living in the community, we talk about both the idea of the continuum of care for those who require a variety of different types of supportive services, as well as the importance of providing recreational and well-being related activities for older adults who may not be fitting within the concept of requiring a level of assisted services. So with that in mind, that was one of the other reasons why both of the two organizations that are represented here were chosen, because the continuum of care that they provide in the community is one that is very broad-based. It's not just related to a level of dependent older adults. So with that intro in mind, if Donna and Anderson and Jane want to say a little bit more about their respective entities and emphasize, in a sense, the two diverse older adult populations that they may be dealing with, and what they might want to add about what they would like society and or the funders to be better aware of going forward.
Sure, thank you. And I'm sure that the other panelists will add. I just recently received a phone call from a faculty member of a university who happens to be an older person as well. And she is a nurse, and she is caring for her 88-year-old mom who lives in Queens. The mother is suspected to have Alzheimer's. We happen to have an Alzheimer's Caregiver Link program sponsored by the New York State Department of Health. And so we connected the caregiver to that program. And in that program, we were able also to assess if home care was an option for the mom, and also meals, because we wanted to make sure that she also received the proper nutritional meal, available to her home. And so this caregiver is so stressed out that she's actually visited the emergency room herself twice in 2 weeks. At one point, she thought she was having a heart attack. She says, this is too much for me to handle, and I'm too afraid of actually considering a nursing home placement for my mom right now because of COVID-19. How can we maintain the integrity of her lifestyle, her faith in the community with services that she may qualify for? And so having, an organization where we have a multitude of programs and services and offer that support and orientation, that does wonders for this caregiver in particular. So that, when I spoke with her and I told her about, the Safe Return program, if she's, demented, the mother, and so forth, and these other things, the entitlements, she had no clue. She says, I never knew. So, and that's the beauty of having an integrated system within an organization that's really there to take you every step of the way as a caregiver and as a consumer if you qualify for the service. Dr. Bella.
So RAIN provides services to both older adults and also persons of all ages through our various programs. And within the RAIN Inc. side, we actually serve both independent older adults as well as, this is our diagram of the types of programs and services that we offer. We have over 20 programs serving both the independent senior as well as homebound persons. And an overriding goal of ours is to facilitate older adult ability to remain in their homes and their communities safely and with the support that they need. And we do that by addressing social determinants of health. And those social determinants of health are relevant to both the independent older adult who comes to our programs as well as a homebound person. And so, given what has occurred with COVID, one of the important elements that we will need to definitely enhance is the area of emotional well-being, and we need to make sure that across all levels and from even a multidisciplinary perspective, and involving partners and engaging really communities in conversations about how we are going to really make an impact, because that is going to be an extraordinary need that the older adult population is going to face, given their homebound status for the last 4 months, particularly those that were previously independent.
And delivering the message where people don't feel less of a person because they are receiving a help, doing it in a gentle, supportive manner, in terms of like mental health services, psychiatric services, really looking at the language that is used within the organization and perhaps call it more a wellness experience, a wellness session, because all of us, through the grace of God, I mean, we can touch so many different elements of existence and all that really impairs a person's functioning. Let's not contribute to a stigma or to scare people away from service. Yes, Don.
Yeah, I love the diagram that you showed, Jane, because that's what we need. We need to be able to provide a holistic approach to supporting the seniors in our community. One of the things that concerns me is that, and Allison alluded to this, is that we people are looking too high level and they're not really thinking about the organizations like the Department for the Aging. They're not, and they don't even talk within their own agency. So we'll get direction from different departments that contradict, what we're getting from other departments in the Department for the Aging. But we have to be able to provide a holistic approach to how we are supporting our seniors. We need better information and help. For instance, my centers are strictly just senior centers, and we do have a transportation program. But we have seniors who have so many other needs. We need better training and partnerships so that we can be able to provide that holistic approach, so that we can at least be able to refer people accordingly, holding their hand as necessary to get them to the various organizations and programs that can help them. The Alzheimer's, and we certainly have several seniors that are starting that early stage of Alzheimer's, and we are not equipped to help them or continue to support them, but we need to be able to refer them. So I love our partnership with Live On New York, because they're such great advocates for us. But it'd be great if we had similar kind of conversations just within the Department for the Aging, to be able to have these conversations about our needs and making sure that they're hearing all of our needs and that they're working internally to provide us with the things that we need. If we didn't have them Live On New York, I don't know where we'd be, because we definitely appreciate their advocacy for being able to have those conversations and making sure that we're being heard. But really, that holistic approach, what Jane's World is doing, I mean, that to me covers how we have to be able to function and how we have to move forward. At least for my organization, we definitely need to be able to move forward in that kind of a way where we're all really prepared and able to refer people more appropriately and recognize those things. As Anderson said, you've got to be able to recognize when people need that help also, and be able to refer them accordingly. Victoria?
Okay, thank you. At this point, I don't know if any of the attendees have been sending in some questions for our panelists. Natasha, you were fielding the questions. Do we have any questions that the panelists would be asked to address?
Hi, Vicki. Yes, we have two questions right now. So I'll go ahead and ask the first one.
Yes, please do.
The question is, it's what, if anything, can we learn from school reopenings to facilitate the re-entry of older adults into essential congregate settings that help them stay in the community? Example, the Adult Day Center. How do we make these settings a priority for PPE? How do we measure the impact closures of centers have had on the cognitive, functional, and physical health of older adults?
Okay, that's a multi-part question, so whoever wants to start tackling a part of it,
I'll jump in on this. It kind of goes back to when you talk about comparing, the opening schools to opening the senior center. It kind of ironically, it's similar in the sense that it's hard to keep those little kids from interacting with each other. When they get back to school, they're not thinking COVID, and they're going to want to play with their friends. And it's a similar situation with the seniors. So we would have a real learning curve for them to get them to understand and get used to social distancing. The other side of that is we're not going to be able to pack in the center like we normally would. So we really have to think about and be strategic about the programming that we offer and how we offer it and stagger it to the needs of those seniors. So it really is about, creating programming that looks a lot different than it does now, and being much more specific and intentional about the services that we're offering. You know, what are we doing today? Maybe today is Ladies' Day. We're having our women's group. We're having the story time. We're having a healthcare person come to speak to the women about health issues for the women. But yeah, it's going to be interesting, but we're definitely going to have to rethink how we move forward and strategize on doing that in a safe way.
I know that the New York State Department for the Aging and the Commissioner, Lorraine Cortez Vasquez, is actually putting together groups of providers so that we could brainstorm as to, you know, what it would look like when we do open, because it's a delicate situation. You may have providers, and you know, the social adult day space is another existence with another oversight or lack of. And so I think as we visit our spaces, we say, well, we definitely have to limit and cannot have as many people as we had here at one time. I remember, and Dr. Bello, you remember we were planning for Mother Turner's 104th birthday. And that was going to draw about 130 people. Well, we may have to celebrate Mother Turner's birthday every day for like 2 weeks and cluster groups of attendees so that we don't expose people unnecessarily. You know, and then we have folks that, you know, have challenges with ambulation, you know, and what do you do with those folks with COVID upon you and the proximity with other individuals and medical complications? So I think that that's also going to involve a certain level of discussion with their medical providers to see who will be able to come in and not pose a contraindication to their health. Something that I don't think we were in the role of doing in the past. But this is COVID.
I also think that the reopening of the senior centers will likely have to be something that's gradual, definitely strategic and very deliberately thought out. And I'm not sure that it's going to be a one size fits all, because we have, even within our own respective organizations, we have different realities from program to program. Some of those realities are just simply facility realities. How many people, how many spaces do centers have? How many people fit in those spaces? And so I think there are a lot of variables that need to be considered. Certainly, at least from our vantage point, it cannot be a one size fits all.
I think we're all going to be looking at the protocols, right? From the leaders in our nation, you know, entities like the CDC, you know, the governor's office and so forth. We're already looking at our corporate side, and we have elders that are still employed as home health aides and so forth. As people come, actually, we're expecting a delivery of a kiosk that will read your temperature, that's touchless. And so if you have a certain temperature, you're not going to be allowed inside the building. And it's limited. You know, no more than 2 people. Everyone else has to wait outside. We put, you know, the plexiglass, we redesigned, and all that needs to be taken into consideration in the various settings. So, you know, Dr. Bello is saying that I may end up with a chocolate chip cookie and she may end up with the macadamia nut, but, you know, not everyone can end up with the same cookie. So it's customized.
If I could add, I think, you know, what I hear a lot of organizations most want to do is not necessarily open as if they were open in October or pre-COVID, but really create a hybrid model that would allow them to give out food as a, you know, takeaway meal, for example, or, you know, it's been really interesting. I live in New Jersey, and there's a lot of conversations around pods, school pods, and how people can hook up with other families and kind of, you know, not or mitigate the risk. I mean, there's equity issues with that across the board. But the idea of maybe creating pods with older adults that they could socialize or do walking clubs. I mean, there's a lot of different ideas. And I think it depends on what the goal is at the end of the day. like the school openings, looking at hotspots, I would say we also need to take a proactive approach. There may be hotspots as schools start opening eventually, or private schools. You know, we know certain data exists where COVID was particularly rampant. So looking at senior housing, or, you know, we know the disproportionate effect of COVID. So looking at older Black beneficiaries in certain zip codes that were impacted before. Well, let's make sure that a service system is set up in neighborhoods so we can be a little bit proactive if we start seeing COVID spike. So I think there's some things that we can start to think about to be a little outside of the box. And I would say the good news is that certainly the folks here on the call and also in our network are really well positioned and thinking really differently. So, you know, that's a good thing. And we will hopefully make sure that the city and the state are asking for those ideas so that they can create guidances that reflect reality.
Okay, Natasha, the other question?
Yes, so we have one more question, and it says, how do you think COVID-19 has impacted the elderly in NYC and around USA in terms of statistics, percentage of testing positive elderly, any patterns seen amongst who are getting positive results, how soon couldn't recover, and what is responsible for most of the fatalities? And what can we do as a citizen, non-immigrant workers to improve the quality of life under this pandemic scenario for seniors?
Okay, another multi-part question. So who wants to tackle one section?
I love the question, right? I'll try and tackle at least one of those points.
Well,
let me tell you, here at RAIN, you know, the mayor some time ago published on a slide, and we saw it on TV. It says like the 10 hotspots for COVID-19. Out of the 10, 5 were in the Bronx, right? And it definitely is an area that we serve. I actually live in one of those zip codes. So when I saw it, I'm like, wow. So looking at also poverty, looking at social determinants of health, looking at all these indicators. So we definitely saw that some of these zip codes were in really poverty-stricken neighborhoods. So there's a correlation, right? How are we making sure that the information is getting at the hands of the most vulnerable, not only in age, but also in socioeconomic status? And what commitment do we have to that? And so we started, you know, being responsible and doing as much outreach and education as possible. You know, I think the testing piece, listen, what I shared earlier, that's a true story where someone was told, someone tested last week, and they were told that the test results will come between 3 and 8 days. As of today, no test result. So if that person has been positive and it's a vulnerable person, you know, with coexisting conditions and you know, someone who's older, then that puts them at a very high risk. And by the time they get the test results, what's happened? How many other people may have been exposed? Or how has their immune system been compromised to a point where it may cause, you know, certain damage that, you know, you can't come back from? So those are the, you know, the inequities that unfortunately we face and are part of, at least for the people that we are serving and experiencing. Dr. Bell?
You know, we recently were engaging in a conversation with a partner about the possibility of doing in-home testing for older adults. And initially, you know, the idea was a little daunting in a way because this would mean an individual coming to the home of an older adult. And so we surveyed the older adults, and we were very surprised to find a substantial number of older adults that are welcoming of this opportunity to have in-home testing for them. Because again, there's still a lot of fear of going to testing sites among older adults, even if they exist. Some older adults are fearful of having to wait on the line to be tested, or just going back out to receive those tests. So testing is an issue, I think, that needs to continue to have some attention, particularly among the older adult population.
And I had a discussion with Dr. Bello on this because I have my pet peeve around, the testing as well. And I just didn't feel that it should be the responsibility of our older or anyone to self-test and self-administer. For those of you that have been COVID tested, it's a little uncomfortable, right? And you might, just have a human reaction and not go all the way as far as you can go to get the reliable test. There may be someone who may have Parkinson's. There may be someone with, with cognitive impairment. How does the provider know all of that? So it's best that it's left to the discipline or the health profession that's responsible for conducting that. It would be great if they took their model to a home visiting doc model and have the professional do it in the comfort of the person's home. That, I think, would be ideal, but not rely on someone to self-administer, mail, and all that kind of stuff.
I just want to clarify that definitely the conversation was never about self-administering tests.
Thank God, Dr. Bello.
That would not be something that we would even entertain. But interestingly enough, there was interest among the older adult population to have someone come into their home and administer the test. So a medical professional, obviously, administer the test.
Donna, you want to tackle something else?
Yes. I was just thinking in terms of the question, in terms of how do, we provide support. So, one of the things we were doing as we're making wellness calls to our seniors, obviously, is checking how safe they were being, if they were having concerns about needing to be tested, as some of them are living in homes with younger people. And what we were doing was sharing with them where testing sites were, in the area, and trying to kind of direct them to where we thought would be smaller, closer to them, safer places. But I agree that that's a challenge. Several of those seniors are just not willing to go out. We're not willing to go out. And I think, we certainly had some casualties because of it. There's the catch-22 for the seniors. Do I take the chance of going out to get tested, or do I not? And then they just continue to get sicker. If they do wind up having the virus. And then for some of them, it's not even about the virus. They need to get to a doctor for other ailments, and they're not going. So yeah, just a lot of concern on how we can make sure that the seniors are getting tested. I'm not sure what our solutions are, but I would love if we could open up our centers to have a day a week, even as it were, to offer to have kind of someone come in and do testing specifically just for the seniors. I think that would be a great thing for them.
Actually, one of the sites at RAIN 2424 Boston Road is a COVID testing site. So. Health and Hospitals Corporation actually has taken over a good portion of the center and has retrofitted it in collaboration with the New York State Department for the Aging to offer that option in the neighborhood.
That's a very good model development to be able to provide that services for older adults. And it leads me into the closing comment that I had, which is sometimes disasters create a awareness of gaps of necessary care and services or changes that need to be made in society. COVID-19 has the potential, and it has already started implementing changes. As individuals who are devoting their time and talents to serving the needs of the older adult population, What do you think some of the takeaways might be from the COVID-19 pandemic as impacting going forward for older adults living in the community? And I'd just kind of like your closing thoughts on this. And whoever wants to jump in first.
Allison, were you going to jump on or?
Well, sure. I mean, I think what's been so striking to me, and because I work on a lot of, on the political side of a lot of things, is how the city and the state and the federal government don't really see themselves in the business of supporting all people's ability to age. You know, more about folks get services from the government, but they're not really out to help people thrive in their life. And yet the money that's being delivered, I'll try to make this as as streamlined of a thought as I can. The money that is being spent on the services through the good work of, you know, my colleagues here today and others, they really, and I believe that you all see your work as serving all older people, right? Like, it's not people who get services and people who don't. It's about how you support your community to create spaces and options for older people to thrive into their later years. And so I think it will really alter the way we think about how to access support, and what that will look like for all sorts of people. I mean, that's my hope. I also think that, you know, the way we think about people's vulnerabilities and strengths will really change. Yeah, I think it's still to be written, but I think there's a lot to consider about how we think about people's lives and what that is worth, and what we will do to support them and give them infrastructure so that they can stay healthy and make the best of their life.
Interesting. It also brings the elephant in the room in terms of a population that people have tried to marginalize through history, and they don't see as important. And it's also a wonderful time for us to really advocate and bring to the front of what truly matters, and how disgraceful it is for society to just disregard the contributions of an older person. Think about how we all started out. You know, we were all babies, we're all infants, we grow, and then through the grace of God, we age gracefully or without too many medical complications and challenges. But, you know, our voice should be heard until our last breath. So this ensures, you know, the coalition, you know, organizations like Live On New York, you know, senior providers, to take the responsibility to be heard, for the issues to be put forward, and for us not to just take no for an answer and knock on that door. And when we get tired, bring someone else who will knock in our place, so that this doesn't go away, because older folks matter.
Yeah, I think that I agree with Anderson and Allison. If nothing else, this pandemic really helped to shine a light on the limitations, the gaps, and the things that just are not working. And I'm hoping that it will allow for an opportunity for our government officials and for you know, the Department for the Aging, and for those who are responsible for making sure that our senior population is taken care of, to take a look at how we can restructure, make sure that we're providing a holistic approach to supporting our seniors, and move forward in a better way. Because certainly, if nothing else, we definitely soared through this process where the limitations are, and where we really fell short, where we just were not prepared to really provide the support that we needed for the elderly community.
And building on what everyone has already said, this is a potential opportunity really to continue elevating and amplifying the conversation regarding older adults, a population that is growing in unprecedented numbers, and a population that was among the most vulnerable in terms of COVID. And so this, while it COVID presented clearly multiple challenges across multiple levels, it's also an opportunity to elevate and amplify conversations regarding meaningfulness around older adults.
Very great closing comments. I thank all the panelists for participating today. This is an important issue. It's one that these voices need to be heard and considered, and I would like to thank everybody for the great work that they are doing in terms of advancing care and wellness for our older adult populations, and appreciate all the attendees who have listened into today's webinar, and hope you will stay tuned for future ones. So thank you all.
Thank you.
Thank you.
Thank you.
Thank you for having us.
Hasta pronto.
Take care.
Okay,
Bye.
the webinar will be available online for anybody who wants to further access it or send it on to others. And stay tuned for future ones. Have a good day, everyone.
You too. Thank you.
Take care.
Yes.
Bye-bye.
Thank you. Bye.